best position for the client to be placed? A. Prone position. B. Supine position. C. Semi-Fowler's position. D. Dorsal recumbent position. The correct answer is C. Semi-Fowler's position. Rationale: after a craniotomy, the head of the bed is elevated 30 to 45 degrees, and the client's head is maintained in a midline, neutral position to facilitate venous drainage. Options A, B, and D are incorrect positions. The nurse is caring for a client following a supratentorial craniotomy, in which a large tumor was removed from the left side. In which position can the nurse safely place the client? Refer to figures. A. Bed 1. B. Bed 2. C. Bed 3. D. Bed 4. The correct answer is A. Bed 1. Rationale: clients who have undergone supratentorial surgery should have the head of the bed elevated 30 degrees to promote venous drainage from the head. The client is positioned to avoid extreme hip or neck flexion, and the head is maintained in a midline neutral position. If a large tumor has been removed, the client should be placed on the non-operative side to prevent displacement of the cranial contents. A flat position or Trendelenburg's position would increase intracranial pressure. A reverse Trendelenburg's position would not be helpful and may be uncomfortable for the client. The nurse is assisting with planning care for a client with an internal radiation implant, which should be included in the plan of care. Select all that apply. A. Wearing gloves when emptying the client's bedpan. B. Keeping all linens in the room until the implant is removed. C. Wearing a film badge when in the client's room. D. Wearing a lead apron when providing direct care to the client. E. Placing the client in a semi-private room at the end of the hallway. The correct answers are A. Wearing gloves when emptying the client's bedpan. B. Keeping all linens in the room until the implant is removed. C. Wearing a film badge when in the client's room. And D. Wearing a lead apron when providing direct care to the client. Rationale: a private room with a private bath is essential if a client has an internal radiation implant. This is necessary to prevent the accidental exposure of other clients to radiation. The remaining options identify interventions that are necessary for a client with a radiation device. The nurse is assigned to care for a child who is scheduled for an appendectomy. Which prescriptions does the nurse anticipate to be prescribed? Select all that apply. A. Administer a fleet enema. B. Initiate an intravenous line. C. Maintain nothing by mouth status. D. Administer intravenous antibiotics. E. Administer preoperative medications. F. Place a heating pad on the abdomen to decrease pain. The correct answers are B. Initiate an intravenous line. C. Maintain nothing by mouth status. D. Administer intravenous antibiotics. And E. Administer preoperative medications. Rationale: during the preoperative period, enemas or laxatives should not be administered. In addition, heat should not be applied to the abdomen. Any of these interventions can cause the rupture of the appendix and resultant peritonitis. Intravenous fluids would be started, and the child should receive nothing by mouth while awaiting surgery. Antibiotics are usually administered because of the risk of perforation. Preoperative medications are administered as prescribed. The nurse is monitoring a preterm labor client who is receiving magnesium sulfate intravenously. The nurse should monitor for which adverse effects of this medication. Select all that apply. A. Flushing. B. Hypertension. C. Increased urine output. D. Depressed respirations. E. Extreme muscle weakness. F. Hyperactive deep tendon reflexes. The correct answers are A. Flushing, D. Depressed respirations, and E. Extreme muscle weakness. Rationale: magnesium sulfate is a central nervous system depressant, and it relaxes smooth muscle, including the uterus. It is used to stop preterm labor contractions, and it is used for pre-eclamptic clients to prevent seizures. Adverse effects include flushing, depressed respirations, depressed deep tendon reflexes, hypotension, extreme muscle weakness, decreased urine output, pulmonary edema, and elevated serum magnesium levels. The medication prescribed is hydromorphone hydrochloride, 3 mg intramuscularly, every 4 hours as needed. The medication label reads hydromorphone hydrochloride, 4 mg per 1 milliliter. The nurse should prepare to administer how many milliliter to the client? A. 0.70 milliliters. B. 0.50 milliliters. C. 0.75 milliliters. D. 0.80 milliliters. The correct answer is C. 0.75 milliliters. Rationale: the formula for this question is desired times quantity over on hand equals to milliliter per dose. So in this question, desired is 3 milligrams, quantity is 1 milliliter, on hand is 4 milligrams. You plug these numbers into the formula, so 3 milligrams times 1 milliliter over 4 milligrams equals to 0.75 milliliters. The intravenous prescription is 1,000 milliliters of 0.9% sodium chloride to run over 12 hours. The drop factor is 15 drops per 1 milliliter. The nurse plans to adjust the flow rate to how many drops per minute? Round the answer to the nearest whole number. A. 18 drops per minute. B. 19 drops per minute. C. 20 drops per minute. D. 21 drops per minute. The correct answer is D. 21 drops per minute. Rationale: the prescribed 1,000 milliliters is to be infused over 12 hours. Follow the formula and multiply 1,000 milliliters by 15. Then divide the result by 720 minutes. The infusion is to run at 20.8 or 21 drops per minute. The medication prescribed is digoxin, 0.25 milligrams orally, daily. The medication label reads digoxin, 0.125 milligrams per 1 tablet. The nurse should prepare how many tablet to administer the dose. A. 1 tablet. B. 2 tablets. C. 3 tablets. D. 4 tablets. The correct answer is B. 2 tablets. Rationale: the formula for this question is desired times quantity over on hand equals to tablets per dose. So in this question, desired is 0.25 milligrams, quantity is 1 tablet, on hand is 0.125 milligrams. You plug these numbers into the formula, so 0.25 milligrams times 1 tablet over 0.125 milligrams equals to 2 tablets. The medication prescribed is heparin sodium, 650 units subcutaneously, every 12 hours. The medication vial reads heparin sodium, 1,000 units per 1 milliliter. The nurse prepares how many milliliters to administer 1 dose. A. 6.50 milliliters. B. 0.65 milliliters. C. 650 milliliters. D. 6,500 milliliters. The correct answer is B. 0.65 milliliters. Rationale: the formula for this question is desired times quantity over on hand equals to milliliter per dose. So in this question, desired is 650 units, quantity is 1 milliliter, on hand is 1,000 units. You plug these numbers into the formula, so 650 units times 1 milliliter over 1,000 units equals to 0.65 milliliters. The intravenous prescription is 3,000 milliliters of 5% dextrose to run over a 24-hour period. The drop factor is 10 drops per 1 milliliter. The nurse plans to adjust the flow rate to how many drops per minute. Round the answer to the nearest whole number. A. 19 drops per minute. B. 20 drops per minute. C. 21 drops per minute. D. 22 drops per minute. The correct answer is C. 21 drops per minute. Rationale: the prescribed 3,000 milliliters is to be infused over 24 hours. Follow the formula and multiply 3,000 milliliters by 10. Then divide the result by 1,440 minutes. The infusion is to run at 20.8 or 21 drops per minute. The nursing student is asked to describe the correct steps for performing adult cardiopulmonary resuscitation. Arrange the actions in the order that they should be performed. All options must be used. 1. Initiate breathing. 2. Open the client's airway. 3. Perform chest compressions. 4. Determine unconsciousness by shaking the client and asking, "Are you okay?" The correct order is 4. Determine unconsciousness by shaking the client and asking, "Are you okay?" 3. Perform chest compressions. 2. Open the client's airway. And 1. Initiate breathing. Rationale: the sequence for basic CPR for healthcare providers follows CAB, compressions, airway, and breathing. After determining unconsciousness, compressions are started. A client with a major burn is admitted to the emergency department. In which priority order should the nurse implement these actions? Arrange the actions in the order that they should be performed. All options must be used. 1. Establish airway. 2. Insert Foley catheter. 3. Initiate fluid therapy. 4. Insert a nasogastric tube. The correct order is 1. Establish airway, 3. Initiate fluid therapy, 2. Insert Foley catheter, and 4. Insert a nasogastric tube. Rationale: the actions that the nurse would take include the following. 1. Establish an airway. Administer oxygen as prescribed. Often the healthcare provider inserts an endotracheal tube to ensure a patent airway. 2. Initiate fluid therapy. Intravenous fluid therapy, usually with Ringer's lactate solution, is started immediately. The amount of fluid given is related to the percentage of total body surface area burned. The client is weighted, so the HCP can determine the amount of fluids needed. 3. A Foley catheter is inserted for hourly urinary output. An hourly output of 30 to 50 milliliters is recommended. Intravenous fluids will assist in maintaining renal perfusion. 4. A nasogastric tube is inserted because clients with severe burns often develop a paralytic ileus as a result of trauma. A 7-year-old child is admitted to the pediatric unit with acute exacerbation of asthma due to infection. The healthcare provider has written the following prescriptions. In which priority order should the nurse implement the prescriptions? Arrange the actions in the order that they should be performed. All options must be used. 1. Clear liquids PO as tolerated. 2. High Fowler's position. 3. Chest X-ray. 4. Erythromycin ethylsuccinate, 200 mg orally, every 6 hours. 5. O2 via nasal cannula, at 2 liters per minute. The correct order is 2. High Fowler's position. 5. O2 via nasal cannula, at 2 liters per minute. 4. Erythromycin ethylsuccinate, 200 mg orally, every 6 hours. 3. Chest X-ray. And 1. Clear liquids PO as tolerated. Rationale: placing the child in High Fowler's position first will assist in breathing. The oxygen can then be applied. Administering the antibiotic is the next priority. The chest X-ray should not be done until the child has had oxygen and the first dose of the antibiotic. The clear liquid diet is the last task to be performed. The nurse is providing directions to the unlicensed assistive personnel regarding clients' hygiene needs. Which is the priority order in which the UAP should assist the clients? Arrange the actions in the order that they should be performed. All options must be used. 1. A client who is independent with ADL. 2. A confused client who is incontinent of stool and urine. 3. A client who is on bed rest after multiple trauma. 4. A client who was admitted for dehydration and failure to thrive. The correct order is 2. A confused client who is incontinent of stool and urine. 3. A client who is on bed rest after multiple trauma. 4. A client who was admitted for dehydration and failure to thrive. And 1. A client who is independent with ADL. Rationale: the confused client should be bathed first because bowel/bladder incontinence would lead to skin breakdown. The client who has multiple traumas is at risk to develop skin breakdown and wound infection. The client who was admitted for dehydration and failure to thrive requires assistance with hygiene needs. The client who is independent with activities of daily living does not require assistance with hygiene. What are the steps in order of priority for application of an ostomy appliance? Arrange the actions in the order they should be performed. All options must be used. 1. Assess the stoma and skin. 2. Remove the used pouch and barrier. 3. Perform hand hygiene and don gloves. 4. Cleanse the peristomal area with warm water. 5. Press the adhesive backing of the pouch against the skin. 6. Cut the opening on the appliance 1/16 inch larger than the stoma. The correct order is 3. Perform hand hygiene and don gloves. 2. Remove the used pouch and barrier. 4. Cleanse the peristomal area with warm water. 1. Assess the stoma and skin. 6. Cut the opening on the appliance 1/16 inch larger than the stoma. And 5. Press the adhesive backing of the pouch against the skin. Rationale: the nurse would wash the hands and don gloves before removing the pouch and barrier. The peristomal area is cleansed with warm water to remove residue and improve visualization. The stoma is assessed for color and the skin is checked for irritation. The appliance is measured and cut 1/16 inch larger than the stoma to prevent strangulation of the stoma or too much room for skin irritation between the stoma and appliance. The adhesive backing of the appliance is pressed against the skin, avoiding wrinkles to achieve seal. The nurse is reviewing the health records of assigned clients. The nurse should plan care knowing that which client is at risk for fluid volume deficit. A. The client with cirrhosis. B. The client with a colostomy. C. The client with heart failure. D. The client with decreased kidney function. The correct answer is B. The client with a colostomy. Rationale: causes of a fluid volume deficit include vomiting, diarrhea, conditions that cause increased respirations or increased urinary output, insufficient intravenous fluid replacement, draining fistulas, ileostomy, and colostomy. A client with cirrhosis, heart failure, or decreased kidney function is at risk for fluid volume excess. The nurse reviews electrolyte values and notes a sodium level of 130 milliequivalents per liter. The nurse expects that this sodium level would be noted in a client with which condition? A. The client with watery diarrhea. B. The client with diabetes insipidus. C. The client with an inadequate daily water intake. D. The client with the syndrome of inappropriate secretion of antidiuretic hormone. The correct answer is D. The client with the syndrome of inappropriate secretion of antidiuretic hormone. Rationale: hyponatremia is a serum sodium level less than 135 milliequivalents per liter. Hyponatremia can occur secondary to syndrome of inappropriate antidiuretic hormone secretion. The client with an inadequate daily water intake, watery diarrhea, or diabetes insipidus is at risk for hypernatremia. The nurse is caring for a client with leukemia and notes that the client has poor skin turgor and flat neck and hand veins. The nurse suspects hyponatremia. Which additional signs/symptoms should the nurse expect to note in this client if hyponatremia is present? A. Intense thirst. B. Slow bounding pulse. C. Dry mucous membranes. D. Postural blood pressure changes. The correct answer is D. Postural blood pressure changes. Rationale: postural blood pressure changes occur in the client with hyponatremia. Intense thirst and dry mucous membranes are seen in clients with hypernatremia. A slow, bounding pulse is not indicative of hyponatremia. In a client with hyponatremia, a rapid, thready pulse is noted. The nurse is caring for a client with a diagnosis of hyperparathyroidism. Laboratory studies are performed, and the serum calcium level is 12.0 mg per deciliter. Based on this laboratory value, the nurse should take which action? A. Document the value in the client's record. B. Inform the doctor of the laboratory value. C. Place the laboratory result form in the client's record. D. Reassure the client that the laboratory result is normal. The correct answer is B. Inform the doctor of the laboratory value. Rationale: the normal serum calcium level ranges from 8.6 to 10.0 mg per deciliter. The client is experiencing hypercalcemia, and the nurse would inform the doctor of the laboratory value. Because the client is experiencing hypercalcemia, the remaining options are incorrect actions. The nurse is caring for a client with a suspected diagnosis of hypercalcemia. Which sign/symptom is an indication of this electrolyte imbalance? A. Twitching. B. Positive Trousseau's sign. C. Hyperactive bowel sounds. D. Generalized muscle weakness. The correct answer is D. Generalized muscle weakness. Rationale: generalized muscle weakness is seen in clients with hypercalcemia. Twitching, positive Trousseau's sign, and hyperactive bowel sounds are signs of hypocalcemia. The nurse is instructing a client on how to decrease the intake of calcium in the diet. The nurse should tell the client that which food item is least likely to contain calcium. A. Milk. B. Butter. C. Spinach. D. Collard greens. The correct answer is B. Butter. Rationale: butter comes from milk fat and does not contain significant amounts of calcium. Milk, spinach, and collard greens are calcium-containing foods and should be avoided by the client on a calcium-restricted diet. The nurse is reviewing the laboratory results of a client receiving chemotherapy. The nurse prepares to initiate neutropenic precautions when the nurse notes which laboratory result. A bleeding time of 3 minutes. B. An ammonia level of 20 micrograms per deciliter. C. A platelet count of 200,000 cells per cubic millimeter. D. A white blood cell count of 2,000 cells per cubic millimeter. The correct answer is D. A white blood cell count of 2,000 cells per cubic millimeter. Rationale: the normal white blood cell count is 5,000 to 10,000 cells per cubic millimeter. When the white blood cell count drops, neutropenic precautions need to be implemented. This includes protective isolation measures to protect the client from infection. Bleeding precautions need to be initiated when the platelet count drops. Bleeding precautions include avoiding all trauma such as rectal temperatures or injections. The normal platelet count is 150,000 to 450,000 cells per cubic millimeter. The normal bleeding time is 1 to 6 minutes, depending on laboratory method used. The normal ammonia value is 10 to 80 micrograms per deciliter. A client has experienced several episodes of sickle cell crisis. Which reinforced instruction should be included in the client's teaching plan to prevent recurrence? A. Vigorous exercise is encouraged to maintain cardiovascular function. B. Iced liquids will combat dehydration and should be consumed regularly. C. Wear shoes and socks when walking outside to prevent damage to the feet. D. To prevent opioid tolerance, avoid taking pain medication at the beginning of the crisis. The correct answer is C. Wear shoes and socks when walking outside to prevent damage to the feet. Rationale: wearing socks and shoes will prevent wounds to the legs and feet, which heal slowly and frequently become infected in clients with sickle cell disease. Vigorous exercise and iced liquids can precipitate a crisis and should be avoided. Opioid tolerance is not a priority or immediate concern for clients experiencing a sickle cell crisis. These clients experience a great deal of pain and require opioids for pain relief. The nurse is caring for a client with a suspected diagnosis of aplastic anemia. Which tests should the nurse anticipate to be performed to confirm the diagnosis? A. Schilling test. B. Sickle cell screen. C. Bone marrow aspiration. D. Complete blood cell count. The correct answer is C. Bone marrow aspiration. Rationale: a bone marrow aspiration will identify aplastic anemia and will identify pancytopenia, a deficiency in erythrocytes, leukocytes, and thrombocytes. A Schilling test is diagnostic for pernicious anemia. A sickle cell screen is diagnostic for sickle cell anemia. A complete blood cell count will identify anemia but may not identify the specific type. A client with sickle cell disease has been admitted to the hospital complaining of a sudden onset of severe pain in the extremities, abdomen, back, and chest. In which priority order should the nurse perform the actions listed? Arrange the actions in the order they should be performed. All options must be used. A. Administer an opioid analgesic. B. Hydrate the client with normal saline 0.9%. C. Administer oxygen. D. Keep room temperature at or above 72 degrees. E. Encourage the client to keep extremities extended. The correct order is C. Administer oxygen. A. Administer an opioid analgesic. B. Hydrate the client with normal saline 0.9%. E. Encourage the client to keep extremities extended. And then D. Keep room temperature at or above 72 degrees. Rationale: a client in a sickle cell crisis will have pain as the body's tissues become hypoxic. Oxygenation is important, so oxygen is applied first. To decrease the pain from the sickling process, the client is given an opioid analgesic. The client is then started on an isotonic solution to help prevent further sickling. Keeping the extremities extended and not bent decreases sickling risk, as does keeping the room warm. The nurse is reinforcing instructions to a client with iron deficiency anemia about iron-rich foods. Which food sources should the nurse include in the discharge teaching plan of a client with iron deficiency anemia? Select all that apply. A. Milk. B. Fish. C. Eggs. D. Liver. E. Cheese. The correct answers are C. Eggs and D. Liver. Rationale: liver and muscle meats, eggs, dried fruits, and dark green, leafy vegetables are iron-rich foods. Milk, fish, and cheese are not significant sources of iron. Alendronate is prescribed for a client with osteoporosis, and the nurse is providing instructions on administration of the medication. Which instruction should the nurse reinforce? A. Take the medication at bedtime. B. Take the medication in the morning with breakfast. C. Lie down for 30 minutes after taking the medication. D. Take the medication with a full glass of water after rising in the morning. The correct answer is D. Take the medication with a full glass of water after rising in the morning. Rationale: precautions need to be taken with the administration of alendronate to prevent gastrointestinal side/adverse effects and to increase absorption of the medication. The medication needs to be taken with a full glass of water after rising in the morning. The client should not eat or drink anything for 30 minutes following administration and should not lie down after taking the medication. The nurse is monitoring a client receiving baclofen for side effects related to the medication, which should indicate that the client is experiencing a side effect. A. Polyuria. B. Diarrhea. C. Drowsiness. D. Muscular excitability. The correct answer is C. Drowsiness. Rationale: Baclofen is a central nervous system depressant and frequently causes drowsiness, dizziness, weakness, and fatigue. It can also cause nausea, constipation, and urinary retention. Clients should be warned about the possible reactions. Options A, B, and D are not side effects. In monitoring a client's response to disease-modifying anti-rheumatic drugs, which findings should the nurse interpret as acceptable responses? Select all that apply. A. Symptom control during periods of emotional stress. B. Normal white blood cell, platelet, and neutrophil counts. C. Radiological findings that show non-progression of joint degeneration. D. An increased range of motion in the affected joints 3 months into therapy. E. Inflammation and irritation at the injection site 3 days after injection is given. F. A low-grade temperature upon rising in the morning that remains throughout the day. The correct answers are A. Symptom control during periods of emotional stress, B. Normal white blood cell, platelet, and neutrophil counts, C. Radiological findings that show non-progression of joint degeneration, and D. An increased range of motion in the affected joints 3 months into therapy. Rationale: because emotional stress frequently exacerbates the symptoms of rheumatoid arthritis, the absence of symptoms is a positive finding. Disease-modifying anti-rheumatic drugs are given to slow progression of joint degeneration. In addition, the improvement in the range of motion after 3 months of therapy with normal blood work is a positive finding. Temperature elevation and inflammation and irritation at the medication injection site could indicate signs of infection. A client with acute muscle spasms has been taking baclofen. The client calls the clinic nurse because of continuous feelings of weakness and fatigue and asks the nurse about discontinuing the medication. The nurse should make which appropriate response to the client? A. You should never stop the medication. B. It is best that you taper the dose if you intend to stop the medication. C. It is okay to stop the medication if you think that you can tolerate the muscle spasms. D. Weakness and fatigue commonly occur and will diminish with continued medication use. The correct answer is D. Weakness and fatigue commonly occur and will diminish with continued medication use. Rationale: the client should be instructed that symptoms such as drowsiness, weakness, and fatigue are more intense in the early phase of therapy and diminish with continued medication use. The client should be instructed never to withdraw or stop the medication abruptly, because abrupt withdrawal can cause visual hallucinations, paranoid ideation, and seizures. It is best for the nurse to inform the client that these symptoms will subside and encourage the client to continue the use of the medication. The nurse is reviewing the laboratory studies on a client receiving dantrolene sodium. Which laboratory test would identify an adverse effect associated with the administration of this medication? A. Creatinine. B. Liver function tests. C. Blood urea nitrogen. D. Hematological function tests. The correct answer is B. Liver function tests. Rationale: dose-related liver damage is the most serious adverse effect of dantrolene. To reduce the risk of liver damage, liver function tests should be performed before treatment and periodically throughout the treatment course. It is administered in the lowest effective dosage for the shortest time necessary. Options A and C are tests that assess kidney function. The nurse is reviewing the record of a client who has been prescribed baclofen. Which disorder should alert the nurse to contact the healthcare provider? A. Seizure disorders. B. Hyperthyroidism. C. Diabetes mellitus. D. Coronary artery disease. The correct answer is A. Seizure disorders. Rationale: clients with seizure disorders may have a lowered seizure threshold when baclofen is administered. Concurrent therapy may require an increase in the anticonvulsive medication. The disorders in options B, C, and D are not a concern when the client is taking baclofen. Cyclobenzaprine is prescribed for a client to treat muscle spasms, and the nurse is reviewing the client's record. which disorder would indicate a need to contact the healthcare provider regarding the administration of this medication. A. Glaucoma. B. Emphysema. C. Hyperthyroidism. D. Diabetes mellitus. The correct answer is A. Glaucoma. Rationale: because this medication has anticholinergic effects, it should be used with caution in clients with a history of urinary retention, angle closure glaucoma, and increased intraocular pressure. Cyclobenzaprine hydrochloride should be used only for short-term, such as a 2 to 3 weeks therapy. The disorders in options B, C, and D are not a concern when the client is taking cyclobenzaprine. Dantrolene sodium is prescribed for a client experiencing flexor spasms, and the client asks the nurse about the action of the medication. The nurse responds knowing that, which is the therapeutic action of this medication. A. Depresses spinal reflexes. B. Acts directly on the skeletal muscle to relieve spasticity. C. Acts within the spinal cord to suppress hyperactive reflexes. D. Acts on the central nervous system to suppress spasms. The correct answer is B. Acts directly on the skeletal muscle to relieve spasticity. Rationale: dantrolene acts directly on skeletal muscle to relieve muscle spasticity. The primary action is the suppression of calcium release from the sarcoplasmic reticulum. This in turn decreases the ability of the skeletal muscle to contract. Options A, C, and D are not actions of the medication. The nurse is reinforcing discharge instructions to a client receiving baclofen. Which should the nurse include in the instructions? A. Restrict fluid intake. B. Avoid the use of alcohol. C. Stop the medication if diarrhea occurs. D. Notify the healthcare provider if fatigue occurs. The correct answer is B. Avoid the use of alcohol. Rationale: baclofen is a central nervous system depressant. The client should be cautioned against the use of alcohol and other central nervous system depressants because baclofen potentiates the depressant activity of these agents. It is not necessary to restrict fluids, but the client should be warned that urinary retention can occur. Constipation rather than diarrhea is an adverse effect of baclofen. Fatigue is related to a CNS effect that is most intense during the early phase of therapy and diminishes with continued medication use. It is not necessary that the client notify the healthcare provider if fatigue occurs. The client who has a cold is seen in the emergency department with an inability to void. Because the client has a history of benign prostatic hyperplasia, the nurse determines that the client should be questioned about the use of which medication. A. Diuretics. B. Antibiotics. C. Antitussives. D. Decongestants. The correct answer is D. Decongestants. Rationale: episodes of urinary retention can be triggered by certain medications such as decongestants, anticholinergics, and antidepressants. Diuretics, antibiotics, and antitussives generally do not trigger urinary retention. Retention also can be precipitated by other factors such as alcoholic beverages, infection, bed rest, and becoming chilled. A sulfonamide is prescribed for a client with a urinary tract infection. On review of the client's record, the nurse notes that the client is taking warfarin sodium daily. Which prescription should the nurse anticipate for this client? A. Discontinuation of warfarin sodium. B. A decrease in the warfarin sodium dosage. C. An increase in the warfarin sodium dosage. D. A decrease in the usual dose of sulfonamide. The correct answer is B. A decrease in the warfarin sodium dosage. Rationale: sulfonamides can potentiate the effects of warfarin sodium, phenytoin, and orally administered hypoglycemics, such as tolbutamide. When an oral anticoagulant is combined with a sulfonamide, a decrease in the anticoagulant dosage may be needed. Methenamine, a urinary antiseptic, is prescribed for the client. The client's chart reads: blood glucose 102 mg per deciliter, chest X-ray, normal, renal insufficiency, folic acid 0.5 mg, orally daily. The nurse reviews the client's medical record and should contact the healthcare provider regarding which documented finding to verify the prescription. A. Renal insufficiency. B. Chest X-ray, normal. C. Blood glucose, 102 mg per deciliter. D. Folic acid, 0.5 mg, orally daily. The correct answer is A. Renal insufficiency. Rationale: methenamine is a urinary antiseptic. Methenamine can cause crystalluria and should not be used in clients with renal impairment. Therefore, the nurse would verify the prescription if the client had a documented history of renal insufficiency. The laboratory and diagnostic test results are normal findings. Folic acid may be prescribed for a client with renal insufficiency to prevent anemia. Trimethoprim sulfamethoxazole is prescribed for a client. The nurse should instruct the client to report which symptom, if it is developed during the course of this medication therapy. A. Nausea. B. Diarrhea. C. Headache. D. Sore throat. The correct answer is D. Sore throat. Rationale: clients taking trimethoprim sulfamethoxazole should be informed about early signs of blood disorders that can occur from this medication. These include sore throat, fever, and pallor. The client should be instructed to notify the healthcare provider if these symptoms occur. The other options do not require HCP notification. Phenazopyridine hydrochloride is prescribed for a client for symptomatic relief of pain resulting from a lower urinary tract infection. Which should the nurse reinforce to the client? A. Take the medication at bedtime. B. Take the medication before meals. C. Discontinue the medication if a headache occurs. D. A reddish-orange discoloration of the urine may occur. The correct answer is D. A reddish-orange discoloration of the urine may occur. Rationale: the nurse should instruct the client that a reddish-orange discoloration of urine may occur. The nurse also should instruct the client that this discoloration can stain fabric. The medication should be taken after meals to reduce the possibility of gastrointestinal upset. A headache is an occasional side effect of the medication and does not warrant discontinuation of the medication. The nurse who is administering bethanyl chloride is monitoring for acute toxicity associated with the medication. The nurse should check the client for which sign of toxicity. A. Dry skin. B. Dry mouth. C. Bradycardia. D. Signs of dehydration. The correct answer is C. Bradycardia. Rationale: toxicity produces manifestations of excessive muscarinic stimulation, such as salivation, sweating, involuntary urination, and defecation, bradycardia, and severe hypotension. Treatment includes supportive measures and the administration of atropine sulfate subcutaneously or intravenously. Oxybutynin chloride is prescribed for a client with a neurogenic bladder. Which sign would indicate a possible toxic effect related to this medication? A. Pallor. B. Drowsiness. C. Bradycardia. D. Restlessness. The correct answer is D. Restlessness. Rationale: toxicity of this medication produces central nervous system excitation, such as nervousness, restlessness, hallucinations, and irritability. Other signs of toxicity include hypotension or hypertension, confusion, tachycardia, flushed or red face, and signs of respiratory depression. Drowsiness is a frequent side effect of the medication but does not indicate overdose. After kidney transplantation, cyclosporin is prescribed for a client. Which laboratory result would indicate an adverse effect from the use of this medication? A. Decreased creatinine level. B. Decreased hemoglobin level. C. Elevated white blood cell count. D. Elevated blood